Okay, Ndogozo, we're all building up, aren't we? Big story globally at the moment is the build-up to the start of the World Economic Forum. Okay, tell you what, we're having a bit of an issue there. We're sorting out Ndogozo's audio connection, actually, because we just realized there's an issue with her microphone. I'm hoping she's able to speak to us now. I think we are. Ndogozo, if you're sorted, let's talk about the World Economic Forum and the expectations ahead of the gathering.
Good evening, Tembegile. Well, the World Economic Forum is saying now is the time to take forward the key learnings from the pandemic to ensure that all stakeholders, from governments to patients, have a shared vision for healthcare by 2035. And for more on what that means, I'm now joined by Shyam, Bishen, who's the World Economic Forum head of Shaping the Future of Health and Healthcare. Thank you so much for joining us from Geneva this afternoon. Now let's start here. The global healthcare sector has seen growth over the last 2 to 3 years, notwithstanding the drawbacks brought on by the COVID-19 pandemic. The sector spent was well over $12 trillion in 2022, with increased investment and funding. But many around the world would argue that they don't see this value for money, an example being the patients and staff at Tambo Memorial Hospital in Boksburg. How does Vision 2035 hope to strike the right balance?
Hello, thank you for having me. That's exactly what we are working on right now, and we will hear more about this during our annual meeting in Davos next week. We have released this report, which is the Healthcare Strategic Outlook for 2035. One of the key areas for our focus is to see how we can build a better healthcare system, how we can transform the overall healthcare system to respond to your question. You know, we see that the overall spending has grown from about 8 trillion to 12 trillion in the last 5 years, which is a huge growth of 50% or more even. How do we make sure that we are delivering value for that money? You know, as you said, clearly there is a challenge here. We are not seeing the value for that money, and then the challenge for the overall global health community is that how do we fix that system? One way to do is to look at value-based payment. You know, we are looking at a payment model where we can pay for outcome rather than services, rather than activity. You know, so working with the healthcare providers, working with product developers, pharmaceutical companies, hospitals, as well as working with the public sector, you know, with the governments, with philanthropies, and with international organizations to come up with that payment model. So that's one area that we are focused on, and we will get the public sector leaders, some health ministers, as well as other ministers, together with private sector, CEOs of the hospitals, CEOs of the pharmaceutical companies, World Health Organizations, and other in Davos next week to discuss that. And we will release that report in Davos next week, actually, the report that talks about payment-based payment models, you know, different kind of value-based payment models. So that's one area. The other area is that how do we fix the overall infrastructure? How do we make sure that there are enough healthcare workers? People are making use of digital technologies. I think that's a breakthrough. There are a lot of breakthrough technologies that can help us in bringing down the cost, you know, so that you don't go after the fixed infrastructure costs, but you look at the digital interventions, you look at the alternative models. We saw that during COVID, telemedicine, for example, became very popular. That was very heavily used, where you could connect to your provider, to your healthcare provider, you could connect to your clinic, your hospital, over the phone, and that we see that's increasing, and that has increased quite a bit. How do we build upon that? That's a key question for us. How do we make sure that the telemedicine is being used across the globe? People have access to Wi-Fi now, and the Wi-Fi access is increasing. How do we make sure that the healthcare community workers, as well as the patients and the population, has access to digital devices so that they can connect with their healthcare providers, connect with the pharmacies and others over a phone call or over a video call? So making use of the digital technologies is another area where we are focused on. So basically, what I'm trying to say is that how do we make use of the digital technologies to transform the healthcare system? Again, we will have a session on this in Davos to talk about use of artificial intelligence, use of new technologies, use of virtual reality, augmented reality kind of technologies to bring down the overall healthcare cost as well as make it more accessible, have better outcome, better adherence, and all those good things.
Now, Shyam, beyond the pandemic, other major conflicts, including Taliban takeover of Afghanistan and Russia's invasion of Ukraine, have also had an impact on health. What is the risk of the continued geopolitical divide on the global healthcare system?
That's clearly a huge risk. You know, we see that for example, when you bomb a country or when you have that kind of conflict, the health systems don't work very well. You cannot disrupt hospitals and clinics and bomb those and expect the health system to work properly. But that impacts not just that particular country. In your example, it doesn't just impact Afghanistan and Ukraine, but it impacts the overall global healthcare infrastructure, whether it's the supply chain of goods and services or whether it's clinical trials, for example. We were running, or many of our partners, private sector partners, were running clinical trials, for example, in Ukraine, and those were disrupted, and that obviously impacts product development for global population. That impacts, health data. So the movement of goods and services, movement of starting materials, the key ingredients that go into making the medical countermeasures, whether it's diagnostics, drugs or vaccines, those all get impacted. So overall, I think that has a huge impact. And then it takes a while before the global health system recovers. And that's an area that we are also addressing through our supply chain discussions in Davos. How do we make sure that during this geopolitical conflict and during these challenges, the supply chains are protected and are diverted in some cases, but we still need to make sure that people in these countries who are unfortunately impacted by these conflicts, they have access to medicines, they have access to medical countermeasures, as well as the health services and access to providers. So again, it's a pretty challenging scenario. It does require a lot more thinking, a lot more figuring out, and it's something that I think we are not just aware of, but we are trying to bring both public and private sector together to work on. And I think the work is ongoing on that. But it's unfortunately a pretty challenging situation.
And just as a final question, let's circle back to you talking about, how digital can contribute to the healthcare sector after reaching $57 billion in 2021. What is happening in that space? So you've discussed briefly what's happening in that space, but how could it benefit, people in economies such as South Africa?
Yes. So that's a really good question, and in my mind, this actually will benefit people more in developing countries, more in low and middle income countries, more in the countries of Africa, for example, than what we have seen in the developed world. In the beginning, 5-10 years ago, it was pretty clear that all these digital technologies, development and the infrastructure was taking place in the developed countries, in the countries of U.S., North America, U.S., European countries. But we see now that this thing is, I'm talking about digital technologies, are pretty easily accessible in many low and middle income countries, be it South Africa, be it India, Indonesia, and other parts of the world, where people have access to mobile phones, they have access to Wi-Fi and cellular data, and then they are able to access medical information, they are able to access health data, health information, and then they can connect with their pharmacies, with their providers. So as we increase access to Wi-Fi and access to medical information as well as the devices, I think people are getting, better access to products and services. And that's one of the things that we try to do, as I said earlier, with regard to digital transformation of healthcare. I think with new technologies, we will see that more people will be able to access healthcare products and services. We will see that there is a better adherence, there is a better outcome on the healthcare side. So the spending on the healthcare, on digital health, we see that digital health companies are able to raise much more money now because the opportunity is there. The shareholders and the investors see huge opportunities, especially in the emerging markets in the developing world. And new technologies are also being used, whether it's artificial intelligence on the diagnostic side, breast cancer and other diagnostics, or even looking at the virtual reality and augmented reality, which is being used in many hospitals. I recently visited India, and I saw that organizations like Apollo Hospital are already using virtual reality to bring healthcare services to their patients. They are already using thousands of telemedicine calls to rural parts of India to bring the healthcare consultation, to bring the healthcare clinic to people in those rural areas. So I do see that there is a huge opportunity here for us to make the healthcare products and services more accessible to people in developing countries.
We're going to have to leave it there this evening, Shyam. Thank you so much for the insights that you've given us and giving us just a taste of some of the discussions that will be taking place at the World Economic Forum kicking off next week. And just a quick reminder that part of our business team members, Xolani Mbanjwa and Tumisang Ndlovu, will be out in Davos next week for the World Economic Forum.